The question, are lightheadedness and dizziness linked with glomerulonephritis? People having chronic kidney disease are often treated with ACE inhibitors or angiotensin II receptor antagonist, like the valsartan you are taking, which will lower the blood flow through your kidneys to subject it to less strain. But these meds also often lower your blood pressure, which especially in the beginning can cause dizziness and lightheadedness. How is your blood pressure now? Otherwise, no. So please see a doc on this. Should the kidney start to function worse, the dose of meds you're taking need to be adjusted downward, since many of those drugs are cleared from your body by the kidneys, so when kidney failure will accumulate and cause side effects. Valsartan for 70% is metabolized by the liver, and for 30% excreted by the kidneys, so this isn't so likely. I hope you're getting good medical care, since you just peeing 100 to 200 milliliters of urine a day might be the first sign of impending end-stage renal failure. After reading your comments you edited, and I find a few things rather odd. Having high blood pressure doesn't cause glomerulonephritis, it's the other way around. People having glomerulonephritis will very often develop high blood pressure. Having developed purpura, in combination with your kidney problem, indeed points to the diagnosis Headedness and purpura, which might indeed be the underlying cause of your glomerulonephritis. Quite hard to treat if it doesn't go well apart from lowering one's elevated blood pressure with ACE or ARBs, and immunomodulating meds e.g. corticosteroids. According to Headedness and purpura in adults, outcome and prognostic factors, most people, 62%, will retain sufficient kidney function. Out of the 250 patients, 11% developed end-stage renal failure equals ESRF. Those who went into ESRF tended to do so rather rapidly, 48% of 27 by 3 years, and all but 2 of 27 patients by 10 years. 25 patients were dialyzed, and 12 were renal transplant recipients. None of these recipients lost their graft because of a relapse of HSP. 32 patients, 13%, had severe renal failure, and 14% had moderate renal insufficiency. In all, 38% of the 250 patients exhibited significant renal insufficiency. Wishing you all the best.